S3 and S4 are low-frequency heart. Sounds best heard with a bell at the mitral area in the left lateral position. S3, ventricular gallop. Occurs early in diastole, right after S2. Mnemonic cadence, Ken to key. It's caused by rapid passive filling of the ventricle and sudden deceleration when the ventricle reaches its elastic limit. Normal in patients under 40, in pregnancy, and in athletes. Pathologic and systolic heart failure, chronic mitral regurgitation, aortic regurgitation, dilated cardiomyopathy, and high output states like thyrotoxicosis. S4, atrial gallop. Occurs late in diastole just before S1. Mnemonic cadence, 10 SC. It's produced by atrial contraction against a stiff, non-compliant ventricle. Normal in older adults but pathologic with diastolic dysfunction, left ventricular hypertrophy from hypertension or aortic stenosis, ischemic cardiomyopathy, or acute myocardial infarction. Diastolic dysfunction, left ventricular hypertrophy from hypertension or aortic stenosis, ischemic CA,